Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Marketing Manager Rachel Rum. In today's episode, we sit down with CompleteRx Chief Operating Officer Rick Burnett to discuss the top hospital pharmacy trends of 2022. Well, welcome, Rick. Thanks for joining us in this one's episode.
Thanks for having me back.
Yeah, so today we're going to be talking about pharmacy trends for 2022. And it seems like, we know there's going to be the main focal point or overall theme and goal of navigating or continuing to navigate COVID-19 for hospital executives, the future COVID spikes and new variants. What are your thoughts on that?
Yeah, no, COVID has definitely had a significant impact on our hospitals over the past couple of years. And on the hospital space, I would say significant impacts on drug and labor expense.
Definitely. So let's move into the trends. I don't want to call it a trend because it's much bigger than that. And, we've just mentioned that it's going to be a main theme. But navigating COVID-19, where do you see things going with that? One thing I think we're starting to see is hospitals kind of moving away from that disaster planning and kind of understanding that they have to adopt those operational norms that they've learned so that we can navigate or run as normal or as close to normal as we can, in the midst of surges or new variants.
Yeah, I think the key really to managing with COVID and really any new future variants goes back to doing the basics very well. And let me give you an example. For example, if you have a solid best practice in place for purchasing and inventory management with a very well-trained buyer, solid performance data monitoring systems, and good communication channels between purchasing and your clinical team, your ability to get patients the drugs they need while managing your costs, the odds of that improves. This isn't to say that you're not going to have any problems with shortages or increased drug costs, but once again, your ability to mitigate their impact improves because you're moving from crisis management more to a controlled environment. In COVID over the past 2 years, we've had multiple CFOs and senior hospital administrators trying to get a grip on the unbudgeted costs associated with COVID. And, part of that is pharmacy. So, for example, on a best practice in our facilities, we routinely provide drug cost variance reports to help explain what's been driving costs. And in response to COVID, we've added and updated the reporting package so hospital administrators can see the impact on the drug variances primarily related to COVID. So having systems like this in place help them manage their cash, provide explanations to their boards, and that's in contrast to other facilities where they don't have that same level of detail because they don't have something as basic as routine drug cost reporting in place at their location. So essentially they're flying blind.
Yeah. So it's really, kind of understanding what good looks like. I know Mark likes to say that a lot and really, making it happen. So another area of focus that, I think we can consider a side effect of COVID, but we started to see as a trend even before the pandemic is staffing. What do you see trending this year in terms of staffing?
Well, I think on a global scale, you've got pharmacists and you have technicians. And industry-wide on the pharmacist side, and this is primarily associated with retail, you're seeing a lot of pharmacists leave the profession. They were on the front line. There's many close to retirement. They got burnout. But as far as technicians, we're seeing that bigger impact on the hospital side. The demand for technicians has gone up. And in addition to that, what we're seeing is that we have wage compression in the market, which has been caused by minimum wage laws right now. And as that happens, once again, you're kind of seeing demand for technicians go up. And as there's fewer technicians, you have minimum wage laws going up. So you're also seeing the wages for those technicians going up. So it's getting to be a pretty competitive market to get qualified pharmacy technicians on the hospital side. And obviously the key there is to make sure that you've got the right staffing and you're doing your productivity monitoring and making sure that your other systems are being optimized so you're not trying to make up for more systems by hiring more people, which is unfortunately common in many locations.
Yeah, so it's kind of full circle to what we were just speaking about. So what about technology? I think we've seen different publications that speak to how I think it was HIMSS recently said that it was 80% of hospital executives are really going to be looking at investing in technology. So what do you think will be a priority when it comes to technology this year?
But, technology is key. I mean, if anything, you saw in COVID how technology was able to help us combat COVID and identify new variants quickly and produce new vaccines.
Hmm.
That's on a global scale, but in the space that we play in from the pharmacy perspective, most hospitals continue to invest a great deal in automated dispensing technologies and continue to invest in new equipment and upgrades. Unfortunately, it's not uncommon for hospitals that they invest in unnecessary equipment or make purchases because they haven't taken the time to optimize the capabilities of the equipment they already have. For anybody out there listening, I highly recommend having a third party that is not commission-based to review your facility needs for making the purchases. Another that we're seeing too on the pharmacy side, and I think this is just globally across the board, is the adoption of video conferencing technology.
Mm,
During the pandemic, many people were accessing their healthcare providers by telemedicine.
sure.
And I think, there was some people that really got used to that. So they're getting used to adopting video conferencing technology.
Hmm.
On our side, we've been using that so people can access technology from an education and training perspective. Recently, we launched a product called Scripts that's online in-servicing for clinicians using a remote platform. So even though this isn't a game changer for the industry, it is, I think, example how we are using technology.
Yeah, I mean it's interesting. Even what we think are the simplest forms of technology have really made a major impact, and we've seen that a lot during the course of the last few years. Um, Well, thanks so much for your time, Rick. I really appreciate it. I think you've offered a ton of really great information for our audience. And I think it's going to be interesting to see how the year sort of evolves. I think we're still on that understanding how to navigate the learning curve of, the pandemic and COVID-19. So thanks so much for your time today.
Thanks for having me. Have a good day.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.